A large group of people that this therapy was originally designed for is chronic sinusitis. So breathing is really not overrated. Breathing is pretty important, and a lot of people cannot breathe efficiently through their nose. And so there's things like sinus surgery, there's things like deviated septum surgery, but really those surgeries are only about 50% effective, and any surgeon will tell you that when you elect to go get those treatments done. So what this therapy can do is it can actually go in, and we're not going into the sinuses, we're just going into the nasal cavities, and we're just pushing on the sphenoid bone. By moving the sphenoid bone, that's going to change the dimension of the nasal cavities, and it's going to improve the space in which the sinus tubes coming out of the sinuses, which are these big pockets basically in your skull that hold fluid, and it's determining how they're going to drain. The other thing is if your nasal passages are really narrow, you're not going to be able to get air up through there efficiently. And breathing is really important because people don't breathe properly. They have more sleep apnea. They have like oxygen deprivation, really. They have more fatigue. They have more allergies. They're not able to clean out the air that they are breathing. And headaches and depression, and I see all kinds of things from just not being able to breathe efficiently. And so that's a big population of people that I see. People that have had chronic broken noses, athletes that have had multiple broken noses, multiple head traumas. Remember, head trauma too shifts your head, and when your head shifts, the area in here is going to shift. And so that is that's a big population of people that I see. So if you're considering sinus surgery, you should do this first because it's no drugs, less money, less time, no healing, and breathing stuff is pretty immediate. So I would recommend this first before sinus surgery, and if it doesn't work, surgery is always an option, but that's what my protocol would be.